Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by my very spooky, I used this last October, co-host, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
I am kind of spooky.
It's spooky month, and this is you and Nils. You guys get down with
I love Halloween.
Yep, down with the
My kids are
hallows.
older. I don't do as much, but I'm still making the gravestones. Still doing what I need to do, Nils.
Yep.
Still
So it
holding
gets
up my
spooky.
end of the bargain.
Most creative holiday.
Yes.
Yep,
Oh, yeah. It's the
most
best.
creative holiday. In my world, it's just the time when candy corn comes back into
Yeah.
my world. The most glorious time of
I
year.
still don't feel it.
Candy corn. Oh, my goodness, candy corn.
I don't mind it, but it's not a big thing.
Yeah. So if you are here, we appreciate you listening. And if you'd like to watch this video, or there is a video you'd like to watch it, you can find that on YouTube at Jason Martin MD.
Yeah.
You can also find all of our social media handles right here.
Yep.
And this is part two. Part two of everything you need to know about facelifts. If you have not already listened to part one, go back and listen to part one. We talk about how to choose a surgeon, what to expect at pre-op, the different types of facelifts.
All the questions you need to ask.
Yeah, lots of good stuff in that episode. So if you did not watch it, you can watch this one if you're already on it, but definitely go back and listen to part one before your consultation. So great stuff coming in here, and we appreciate everyone listening. Subscribe if you haven't, like us, comment, all the things. So let's talk about facelifts some more.
Yes, let's do it.
This is where we get into the details about the surgery
I could talk about this
itself.
for hours.
That's why we're going to get right in. So, Dr. Martin, let's talk about this is what everyone wants to know. The step-by-step of a facelift. What happens? So you're there.
Yep.
The IV is started. You're at the hospital. What is going to happen next?
Okay, the surgeon will probably mark you. That's what I do at least, and they'll mark around your ears. That's where the incisions go, and we have multiple episodes on where the incisions go, and you can look on our Instagram channel for that. The anesthesiologist will see you beforehand, and then, if everything's good, you've signed all your consents, you'll be taken back to the operating room. They'll lay you on the table. They'll give you some happy medication. So it's, you're going to be nervous. That's okay. But then you'll feel a lot better. And then before you know it, you're asleep. There's three ways to do anesthesia for a facelift. There's local anesthesia. There's 4 ways. Local anesthesia, local with a pill to make you relax, intravenous sedation, okay, and then general anesthesia. Intravenous sedation and light general anesthesia aren't much different, so I really don't care one way or the other. People make a big deal out of that.
Oh, they make a huge deal out of that.
It's pretty much the same medication, which is called propofol. That's what you get with colonoscopies and EGDs. So I think it's like overstated to get too up in arms about that, but some people don't like having tubes that go in the back of their mouth and down into their breathing area. I get that.
But even with IV sedation, you still have a spacer.
Yeah. And IV sedation, sometimes they'll put in nasal cannulas or a laryngeal mask or, so it gets really into the weeds. Most likely, if you're going to an operative facility, you're going to at least have intravenous sedation, most likely general anesthesia, and that's surgeon's preference. Once that's done, they're going to reposition the bed. They're going to prep and drape. Amy, how would you describe that to a normal person?
Make everything as sterile as possible.
Right. And we're going to wrap you up with sterile sheets, and then we're going to start the surgery. The surgery is started with a timeout. That's universal. And then we inject the local anesthesia, the tumescent fluid, underneath your skin. What that does is create a plane for elevation of skin and also decreases bruising and bleeding.
Yeah, I think some people are surprised by that. Like, the reason we put you to sleep is not so that we can do this without pain medication. Like, you are still numbed in the areas of surgery,
right,
even when you're asleep. And that helps with your comfort.
Yep.
A person who is asleep can still twitch and experience pain.
Right.
So we don't want you to be in pain, even if you don't know you're in pain.
One of the things with facelifts, and Amy knows this, is that you don't want the blood pressure to go up high. Mm-hmm. And pain, even when you're asleep, will elevate your blood pressure.
Yeah.
Okay.
No
even though
fool
you're
in your
not
body, it's smart.
mentally sensing it, your body senses it, and the blood pressure goes up. So I numb you up, so you literally don't feel it even when you're asleep.
Yeah. So then the type of incision you're going to have is that's the next step. Everything's marked. You're numb.
I feel like I could give something to Nils. I don't know what that's going to be yet. He's going to put it right here.
Scalpel?
No, yeah. I'm not going to give a scalpel to Nils, Amy. He's not plastic surgery trained. What are we doing, sir? We're going to give him a picture that shows kind of the markings that we do around the ear. Okay. So it goes into the hairline. It goes around your helix, which is the upper part of the ear. It goes behind and inside of the tragus, which Amy and I have always talked about, is what she presses down really hard when she doesn't want to hear what I'm saying to her, around the lobule, which is where your earrings go, into the crease behind your ear, which is called the retroauricular sulcus, and onto the hairline, which is back in the back of the hair. That's called the occipital hairline. That's for neck lifts. So those are where the incisions are going to be, and you're going to do some version of that, no matter who you go to, no matter what special sauce surgery they do or what unicorn procedure they've invented.
Yeah, there has to be some incision somewhere.
Yeah, that's going to happen.
Yep. And also, if you're having a neck lift procedure, you might have an incision under your chin as well.
Yeah. And the neck lift, by the way, is always going to have an incision that really goes back towards your occipital hairline or the hairline and then behind your ear. And a lot of times with the neck lift, you'll have a submental incision, an incision underneath your chin. A lot of people get really worried about that. That incision heals so well.
Like, well, who among us doesn't already have?
I have two.
Childhood. Yes.
We've talked about this before. I'm having a Groundhog Day moment right now.
Let's just say we all have
We've had this conversation, right? Okay.
Yeah.
All of us have scars underneath from falling down.
I love when I say that to people who are like weirded out by the incision of their chin. I'm like, I have one. They look at me. They're like, I can't see it. I'm like, exactly. Yeah, because it heals really well, and you're not looking up at people's chins, even a tall person.
Yeah.
Maybe the resident that was with us today, but he was.
One of the things we're not bringing up in this is that rarely do I just do a facelift alone. I'll do eyelid procedures, a rhinoplasty, or nose job, or even a brow lift, and those obviously have incisions in different areas and can increase swelling and bruising afterwards. But we're really just focusing in on the facelift part of the procedure.
Mm-hmm. That's why it's everything you need to know about facelifts.
So you make your incision, and then you elevate the skin and soft tissue.
That's in the work.
Yeah, and this is step 3. Step 3, and you elevate the skin and soft tissue and expose the foundation to wherever you need to elevate it to. It could be a little bit for a mini facelift, a lot of skin and soft tissue for a full facelift. It could be down around your neck, even underneath your chin is totally elevated. It just depends on how you present. Again,
I love those videos on TikTok where the doctor has their hands completely inside the person's face and like does this like dramatic, like makes them look like a freaky dinosaur thing with their skin.
Well,
yeah. It's so weird.
Okay.
We don't do that.
Yeah.
Those things you see on Facebook, we don't do, or on Instagram, we don't do that. That's weird.
Right. So once you elevate things and visualize, you get a little hemostasis, and then you treat the foundation. This foundation is called the SMAS, S-M-A-S. And the direction that you fix that will really be the ultimate result of the surgery. The SMAS can be fixed up in a more vertical position, which really helps with the nasolabial folds and marionettes. It can go more back behind your head, which can help with the mid-face and the jawline. And even behind the ear, the platysma and the SMAS can be elevated to help with that girdle around your neck to give you more definition there. So that's really where the yeoman's part of the work goes. And again, you can do that in a deep plane. You can do that in a high SMAS. You can do a SMASectomy. No matter what anyone says, the results are long-term the same. And it just depends on the vector or the direction you're doing that. Skin is redraped. And then the excess skin is removed. There's really minimal points of tension upon insetting of the skin after you remove the excess skin. The only 2 areas, at least for me, is at the top of the ear and then behind the ear at the top point. Everything else is inset without tension. So if you think you're going to come out with a super pulled skin look, you're not, because we're not insetting it that way. It's just a perfect insetting. And you're talking about millimeters, curving these incisions around your anatomical areas. A lot of people worry about how that looks, and once they're healed in these anatomical creases, you really honestly don't see it. I mean, it's amazing. I wish you guys could come with us and see what these people look at 3 or 4 weeks. It's almost not visible.
Even at 2 weeks with some patients. I think the one thing that is remarkable, once you have elevated all the skin and done the internal work, when you do lay that skin back over, in some cases it completely covers the ear. We have that great video of the vector of pull on our Instagram page, which is at Jason Martin MD, where Dr. Martin actually shows, and you have some retractors, and you literally have enough excess skin to completely cover the ear.
Yeah.
Like that's how much excess skin is sometimes there. Like it's more than you think. And that's why it's important that there is an addressing of the layers underneath, because if you just were to pull that skin and you're pulling it over things that underneath that have not been moved back to where they should be, it's not going to be a long-lasting result. These procedures like thread lifts or other things where they're not really addressing everything are not long-lasting for that reason, because they're not addressing the true fundamental issue that you have and then also the excess skin.
Yeah.
Like they're not doing both.
Because the aging process is loose skin and also loose foundation, mostly foundation, but there is some loose skin there. And then loss of volume, most importantly. So, by the way, we'll, kind of repair the operative wounds, close them up in 2 layers, deeper layers and more superficial layers. And that's really small sutures around your ears. So even right afterwards, you really don't look weird. And then at the same time, we can also put in some volume if we need to. Usually it's your own fat, so fat transfer. You also put a drain in at the end of the case. You do the same thing on both sides. That takes a little bit of proficiency to have mental. I'm closing my eyes now. Do you notice that, Amy?
I did notice that. You're in your mind.
I'm doing it now.
You're doing it in your mind.
I'm doing it. Everyone is, please go away. I'm having a personal experience.
I'm doing surgery in my head.
Yeah. So you have to be able to mimic what you do on one side or the other. And that's where it's really interesting. I'll have the fellows come in with me and they inevitably say the same thing. Like, how do you do exactly the same thing on both sides? I'm like, it becomes second nature. And, surgery is somewhat about intelligence, but more about proficiency. And think about things that we don't attribute intelligence to, which I think these people are very intelligent, but like tradespeople, people, have you ever watched someone do, like I always watch these things where people are making bowls out of clay or things like that. And you watch them and they're so proficient.
Trying to have a ghost moment.
What? Oh God.
It's spooky month, right?
That is the worst. I got that. Can you show that or no?
Pull in some Patrick
Just show it for
Swayze.
4 seconds so we don't get charged for that one.
I think that's all right.
I think he's dead. He doesn't get the royalties anymore.
He's reaching his hand around. But that proficiency, that mental memory is so amazing that you can like repeat it on the other side and it's like literally the same. And that comes from hours and hours of work. Malcolm Gladwell, 10,000 hours and 10,000 more on top of that. So, but making sure that those insetting of the scars and everything you do are perfectly the same on both sides, making sure it anatomically goes around the ear perfectly, and then it's not under too much tension so it heals well. These are things that are the nuanced things that makes it so good, right? It goes from okay to really, really good. If you see someone who's had a facelift and the scars are readily visible when you're looking at them, that's a bad facelift. That should not be the case, or they had some healing issues. So, you should expect coming out of the operating room that your scars are very well hidden, and even right after surgery with your hair down, you won't see anything.
You'll feel it.
Yeah. Once it's done on both sides, you'll have surgical drains in most cases. And if someone says they don't use surgical drains, I don't care because the drains come out the next day. So let's just get over ourselves. You wrap the head up and you're going to look like a mummy, a habit, something that looks like you had brain surgery. Basically, your head's all wrapped up and that'll come out the next day. So,
in most cases.
Most cases.
Yeah. So it seems simple because it kind of is. It's one of those surgeries that is very finessed and detail oriented, but also it's not like there's, again, you see these 4 steps, like, numb it up, do the work, close it.
Yep.
It's.
And the closing part is where you get into like the real fine detail. The closing part is where I live and I love. But in reality, you're not going to tell the difference between a millimeter one side to the other. It's impossible to see it. I do, but an average person can't.
Yeah. So that's the step by step. Let's take a little interlude here and talk about the risks and complications.
Very good. Yeah.
Yes. So there are risks with any procedure. And I do tell patients this, the consent from the American Board of Plastic Surgeons is like 12 pages long. However, it's really only the first page that talks about risks specific to this surgery. The rest of it is risks of any surgery. And most of these things are risks of literally any surgery.
Yeah. Infection, pain.
Yeah. So, risks of any surgery. Bleeding, infection, need for additional surgery, the risks of anesthesia, those are risks of any procedure. Bleeding is kind of a specific one after a facelift. And Dr. Martin talked about making sure that you keep your pain under control and your blood pressure down, because all of those things can increase your risk of bleeding postoperatively.
Anytime you have a raw area underneath the skin that's open, it creates a nidus or an area that could have bleeding, and the blood could accumulate. And the reason you bleed, besides the fact that you didn't get adequate hemostasis in the OR, the surgeon, is that afterwards your blood pressure goes up, and then all of a sudden you start kind of really oozing from these areas, and that starts to collect, and that's a problem. So after surgery, that's why I keep a lot of people overnight in the facility, is to only for one reason, is to monitor their blood pressure and give them IV pain medication. Not that it's a super painful surgery, but I want to keep them super relaxed so we don't get that situation where the blood pressure is high. And these are people that usually aren't young, so older people tend to have what, Amy? High blood pressure. And we get a lot of people that come in, they're like, my blood pressure is perfect. I'm like, well, you're 140 over 90. That's not technically perfect. And so if you're 140 and 90 over baseline, then you're probably going to be 160 with pain and discomfort. And I don't want the systolic blood pressure, the upper number, to be over 150 with the surgery. So it's really important to, watch that blood pressure and to avoid bleeding. The other one is really nerve injury for sure. You could have nerve injury to the sensory nerves, especially the ones around your ear. You could have nerve injuries, which is more devastating to the nerves that feed the facial muscles. And we've, knock on wood, been lucky in our career, but if you do enough of these, you're going to have some issue somewhere. And so you need to understand those risks before you go into surgery. Again, in proficient hands, that's extremely, extremely low.
Yep. Other things that are kind of expected in the acute time frame is some numbness or changes in skin sensation. That's not a risk.
How long does that last for?
Depends on the patient. Some people complain about that for up to 6 months or even a year of just some like unusual feelings. But right away, universally, people are somewhat disconcerted by the fact that
it's numb. I'm like, because that divided the skin,
like
underneath the skin. Yeah.
Well, we also put numbing stuff in there. That takes a while to be reabsorbed by the body. Like just in general, your body kind of sends these inflammatory factors to the area that do kind of blunt sensation because of the inflammation. So that is somewhat expected. It's not, it is a complication of surgery, but it's not an unexpected one, and it's something that does go away. Bleeding can lead to a fluid accumulation as well. Bleeding and inflammatory fluid accumulation, which we talked about, hematoma and seroma briefly.
I don't know if you put this on here, bruising is inevitable with a facelift, and that can last a long time. We've had people with bruising for over a month.
Yeah. Infection, absolutely risk of any procedure. Pain, which persists, and that's something that, is so patient specific. Pain after this procedure is extremely minimal in most cases.
It's actually very well tolerated.
Yeah, pain, discomfort that lingers around the ears. I think what someone thinks is pain that's lasting longer than they expected might be 3 days, might be 3 weeks, and those are conversations that you should continue to have with your surgical team, but you can have pain that does persist longer than you think it perhaps should, and that it may be completely normal. 3 days later to have pain. I've had people ask me like, well, this still hurts. I'm like, you had surgery 3 days ago. Like, yes, it still hurts.
I like the positive outlook, but
yeah. Or even a couple weeks later, like, oh, well, it hurts when I do this. I'm like, well, hey, don't do that. Yeah. And like, yeah, that's fine. It's going to hurt.
That's what I sound like when I talk to my kids. Well, like, but this hurts. I'm like, then don't do it.
Don't do that. Yeah. Poor wound healing or skin loss. And those are things that, you try to make sure that people are great candidates for surgery, but things still happen even in really healthy people.
We've had areas of skin loss, little areas of hair loss. We've been really fortunate. Those have really not had devastating outcomes, but you can have large areas of skin loss. Unusual, again, very rare. But if you're diabetic, hypertensive, uncontrolled,
or you get an infection,
anything. So there's so many just rare things that can happen. You can end up in that situation.
Yeah, that can also lead to some skin irregularities or discoloration. And that's something, again, we have seen, people who have maybe really persistent bruising. It can linger and almost create like this kind of hazy effect of the bruise still being there, for months after surgery. Dr. Martin mentioned hair loss.
What's the topical cream you usually give for that?
Vitamin K.
Yeah, vitamin K.
Vitamin K, we talk
about... Just FYI, just put that in your Rolodex.
Yeah, supplementation around surgery is a great episode to listen to where we do talk about vitamin K orally and externally. Hair loss, which is usually temporary. I always do warn our patients that we do cut some hair. So when you wash your hair the first time, it's going to look like you're losing a lot, but it's not. It's hair that we clipped. The hair is still intact at the root, but we did cut some hair. So it's going to look like you're losing a lot, but you're not.
To be real clear, we don't shave your head.
No, we don't shave. That's why we cut some hair.
We cut a little bit of hair.
Yeah. But we don't shave it. So that's what I mean. It's not lost hair.
You're not going in for brain surgery.
No.
Yes.
And that is temporary and grows back. So unfavorable scarring or the scar location. And that's usually...
That's as a proficiency.
Yeah.
You're not... If you go to a proficient surgeon, you shouldn't have that.
Correct. Like your scar placement should be well planned.
You should expect to have good scars.
And asymmetry. I think there are times when someone has inherent asymmetries that maybe they don't perceive until after surgery because they are now staring at themselves 24 hours a day.
Right. And, you can make asymmetries better, but it's not going to go away completely.
No. That's why your pre-op pictures are important too. There have been times we've shown someone like, no, like you did have this asymmetry prior to surgery.
I never noticed that.
They never knew.
Yeah.
Yeah. Not so much with facial stuff because we do look at our own faces a lot. Those tend to be more things with the body where we're like, yeah, your hip sticks out like this. Like, it does. That's your hip bone.
You have scoliosis. No, I don't. Look at this picture.
Yeah. Or someone who has a terrible...
your whole spine was like curving like this. So they're like, wow, I never noticed that.
Never looked at myself.
All right.
Yeah. So those are things, to kind of keep in mind.
We love our patients. We're not criticizing them.
Every surgery has some risks. So let's take a quick break. We're going to come back and we're going to talk about post-op.
Nils and I are going to plan our Halloween outfits. Maybe we should wear that on the next one. Yeah, we'll see.
For the 15th?
That seems like too much work. We'll make Nils wear it. That's good.
We're back. And this actually is probably some of the most important part of our discussion here is talking about post-op. And this is, I think people don't tend to think about it a lot, or they think about it too much, but we're going to hopefully help you be prepared for recovery.
This is more your expertise. We've talked about the stuff where I do amazingly well.
Yep.
But this is when the wheels fall off.
And then they get rolled out of the OR and life goes on for everyone.
I don't know who that person is when I'm done. See ya.
Like, bye. Yeah. So prepare.
Joking.
I think you should spend as much time preparing for recovery as you do kind of preparing for surgery. I mean, there's a lot to think about. Number one, read your post-op instructions and review them
That's
with
a crazy thought.
your primary caretaker.
I mean, what?
You know how many questions I get?
Should we read it beforehand, Amy?
That I'm like, man, this is all, I mean, I'll get lists of, and this is a person who's like, a couple days out from surgery with all these questions. I'm like, this is all in the post-op instructions, but I'll answer it. It's fine. The person who's taking care of you after surgery should also review it, so that they know what to expect. I think that tends to relieve a lot of anxiety. It can be very anxiety, inducing to be taking care of someone after surgery if you don't know what to expect, if you don't know what's normal. So give that person your post-op instructions so they can read it, so they kind of know what to expect also. You should know when and where your first post-op appointment will be.
Yeah, we always talk about this one.
Yeah.
It's not back at the place you probably had surgery.
Yes, most likely it is
and it's
not.
definitely not at the pharmacy.
Yeah. Make sure you get prescriptions filled prior to surgery. We have a lot of patients who are running around after surgery trying to get their prescriptions filled.
The nurse will call me like, the patient needs her prescriptions. Like, we definitely got, those were definitely
We e-prescribe. We can see that they were sent.
Yeah, they were sent.
Yeah.
To the pharmacy they wanted.
Yeah. Purchase any recommended post-op products. We have the pillow system we recommend, ice packs. Like, ask your doctor, like, what things should I have on hand? If they haven't given you a list, we provide people a list.
Do you remember the name of that pillow system? I feel like there was a comment in one of our videos about that.
It's not a name. I always send people the link. So if you want the link to the pillow system, just comment.
Leave a voicemail. Leave a voicemail for Amy. Ask for the link.
Comment below, actually, would be easier.
Even comment better.
Yes.
Yeah, comment below this video.
Think about how you're going to sleep. This is where the pillow system comes into play. But also, if you have a bed that's really hard to get into, maybe that's not the best place to sleep after surgery. So think about those kinds of things too.
What do you recommend, like a hammock or something?
Hammock, no. Don't worry. That seems scary to get out of after. I've fallen out of hammocks too many times to think that's a good idea.
I absolutely don't feel like hammocks are comfortable.
They're not comfortable, and I feel like they're hard to get out of.
Yeah, I do. I agree.
Yeah, so I feel like every time I get out of a hammock, like 9 times out of 10, perhaps it's fine. But then that 10th time, I somehow managed to flip the hammock.
Yeah,
and,
you flip it over.
Myself to the ground.
I've done it.
Sober, throw myself to the ground. This is a really important one that I think a lot of people would not think about. Is think about the things you use on a daily basis, and more specifically with Facelift, think about things that you go for that are low. So if you reach down a lot for things, move those things to waist height. You're not going to feel great. Even if you feel fine, it's going to feel real uncomfortable to be bending over with your head below your heart. Yeah. And we don't want you spending a lot of time in that position. So things that you use a lot, not so, the high things are not as much, but it also may not feel super comfortable, like really extending your neck after surgery. So getting things as close to like eye level or like waist level, I put, as possible that you use on a daily basis is going to be very helpful after surgery.
When you're in that dependent position, that blood really wants to pool. It hurts. Yeah. It's achy. It doesn't feel good. So having those things up.
Yeah, to where they're easy to get to. This goes right into wearing things that are easy to put on, and this is your front closure. So we don't want you putting things over your head and or really taking them off over your head.
We've told this one.
The sweater stitch.
We had a patient who had a T-shirt on and came in for suture removal.
It was a sweater.
Was it a sweater?
Because it was a hot day. It was like February, but it was a warm day.
Warm day, and he took his sweater off and ripped his earlobes off on both sides, but chose not to come back in.
Well, he took it off while he was driving, and to be fair, I had told him, to be very careful because he was wearing a sweater that had a high neck. I said, you need to be really careful. So I had told him all this before he left the office. I'm like, the possibility you could dislodge your earlobes.
So it makes it even worse that you had this conversation. Right, well, so that doesn't make me feel better.
He's like, I reached up and like there was just blood running down my neck. I'm like, but he didn't want to, be in trouble. So he didn't say anything. So 2 weeks later, a week later when we saw him, I'm like, what happened here? He's like, oh yeah, that happened right when I left. I'm like, well, you turn around, come back. So yes, be careful. Like just wear zip ups, button ups.
Yeah. You don't want to take it off over your head.
Yep.
That's the main thing.
About 2 weeks, really. You should plan a lot of clothes that are easy to put on.
Yeah, I agree.
And slip on shoes. Because again, bending over to tie your own shoes, not so much fun. So slide on shoes, things that zip up or hook up in the front are going to be your best friend. There you go.
It's normal to be nervous and excited.
Even after surgery, people are like, you want to get to the end, right?
Yeah.
So you'll get there. You'll get to the end, not to worry.
It's normal to be nervous and excited before surgery too. Yeah.
And after. Yeah. All right. Let's talk about kind of the phases of recovery.
Oh, I love
so
this.
what to expect.
So helpful.
So Dr. Brown, initially after surgery, what's going to be happening?
Yeah, you're going to be swollen. You're going to be tender. You're going to look funny. In some cases, if you had eyelid work too, you're really going to look weird. You're going to look like you've been, in some cases, assaulted. It's going to have a weird swollen look to it.
And now, as you mentioned, bruising is expected.
Bruising is very common. You're going to feel numb. Now, in my hands, in more proficient hands, people look pretty good. You see them the next day, you're like, wow, they're looking pretty good, but they still look like they had surgery, kind of swollen and distorted. You cannot judge your results on postoperative day number 1. I'm going to say that again.
Even on postoperative day 30.
You cannot judge your results on postoperative day number 1. Please, when they take off the dressing, realize that you are a swollen mess. Okay, you're kind of a hot swollen mess at that point.
And you may have been wrapped for like 24 hours.
Right.
So like you're going to have swelling in weird places.
Weird places and stuff like that. But it's going to be okay. By the way, in this recovery time and that first initial time, even if you didn't have eyelid surgery, really just put ice on your eyes if your surgeon's okay with it. As long as they're okay with that
Follow their
recommendation.
instructions.
Follow their instructions. But ice on the eyes in the mid-face makes a big, big difference. I put ice on people's eyes right away after surgery.
Yeah, so that's the initial. Like you're going to be swollen, you're going to have tenderness, you're going to have pain, discomfort in the ears, I think is the one thing that even though we say this a lot on this podcast, people don't expect their ears to hurt.
And they will hurt.
Had a facelift.
Yeah, they will hurt because that's where the most of the work is done. Also, the drains come out around the ears, so the drain site hurts if the surgeon uses drains. Most people do.
Yeah.
So it's going to hurt there. Now that hurt is can be notable in the first 24 hours, and then really starts to dissipate really quickly for a high majority of people.
But you're going to have achiness around your ears for weeks.
Yeah.
Several weeks. Like your ears will be tender. You know, it's not like you have constant pain, but like you won't want people to hug you tight. You're not going to be sleeping on your side on your ears. Like your ears for this procedure are going to be the thing that causes you the most discomfort for the longest, for sure.
In our experience, patients really don't have severe pain after the surgery. It is extremely rare. So if you talk about a scale of 1 to 10, 10 being the worst pain ever, you're talking about 6s at the most.
Oh, at the most.
At the most.
Yep.
And then once you get those drains out, it goes down to a 3. It's very tolerable. They can sleep. They don't need a lot of pain medication. Yeah. You may have had friends who've had this surgery and they had tons of pain medication. That was on them, right? You shouldn't need a lot of pain medication with this. A couple days and you're done.
Yeah, and pain is subjective. Like I'm never going to tell someone they're not in pain, but is it a high level of pain? Absolutely not. So week 1, very limited activity. However, we want you to walk. This is not something where you're going to be bedridden and laying in bed. And people ask us sometimes, like, well, how long will I be bedridden?
Right. They want
0 days.
Exactly.
You will be bedridden for 0 days.
They want a wheelchair. I'm like, you didn't have leg surgery.
Yeah. Like you are fine. Like you will be sleeping on your back at an incline. And that's where that pillow system really comes into play, or just a lot of people have the beds that adjust. Anything that's going to help you sleep comfortably at an incline on your back for several weeks is going to be really helpful. You'll probably be taking some level of pain medication. Most of our patients are taking over-the-counter pain medication, Tylenol, after the first day or so. Muscle relaxants are something that we prescribe patients. Not
People really like that, yeah.
Yeah, things feel tight, right? They're tight because we've made them tighter, but they also are tight because they're swollen. You know, so things are going to feel tight and uncomfortable. That can also be a little bit anxiety provoking in some people. So a muscle relaxant just kind of takes the edge off all of that.
Takes the edge off everything.
Just makes you feel better. Easy walking. This is not the time to exercise. You will not lose your gains in 1 week. You will not.
Even though I feel that way sometimes.
I mean, I agree, right? But you won't. So you will.
You're going to be fine.
Yep.
Your face is worth it.
It's worth it. Yep.
Your triceps will be there when you're done.
And good recovery is worth it, really.
Yeah.
So we're not saying these things because we want you to lose your gains. Like we want people to be active. We just want them to be smart.
Right.
So weeks 2 to 3, most people can return to things like work and driving. A lot of our patients are back to work, you know, especially on like conference calls or emails within a few days of surgery because, you know, recovery is kind of boring. You get back to doing some work stuff. You're going to be feeling much better. Week 2, for 100% of our patients, I think they're amazed how much better you feel the second week than you did the first week. That first week can be kind of rough. You feel underwater. You got the effects of anesthesia. Like you just don't feel like yourself. Things feel tight. You feel weird. By week 2, you're feeling pretty good.
Yeah.
But you still have to limit your exercise and activities.
Which is hard because you're feeling pretty good. So you just want to get back to your triathlete training, whatever dumb thing you're doing this week.
Right. Can I just ride my Peloton a little bit, you know?
And like, no, we just need to not elevate the blood pressure and heart rate. And don't get me wrong. We do facelifts and neck lifts all the time. And we've had people go back to work within 3 to 4 days. We've had people show houses, like real estate agents. Be in court, like do, business things, like things where, you would feel that you'd be socially not ready to do and they do it. But you cannot elevate your heart rate and blood pressure, or at least that's our recommendation, which is the correct one. Yeah. So you want to keep the blood pressure down and the heart rate down so you don't have inordinate swelling of your face, which can slow your healing and make your incisions worse. So you really want to support yourself positively, keeping that blood pressure and heart rate down. Walking increases lymphatic flow. Amy sometimes will do tapping and some lymphatic massage stuff if you need it. Vitamin K cream if you have a lot of bruising. Light therapy. There's a lot of little different things, but the main thing is not to do exercise for at least 4 weeks.
Yeah, and always follow your own doctor's instructions as well. So weeks 4 to 6 for us, our patients are allowed to gradually increase their exercise or activity, kind of get back to your normal activities.
Side sleeping with an exclamation point.
That's on week 7 and beyond. Return to most post-op activities. By week 6, you're traveling, you're doing all your things. Week 7 and beyond, you're pretty much back to everything normal. You can try side sleeping. Our patients can try side sleeping. My favorite patient still is the one who asked when they could sleep on their side. And I said, you're fine to sleep on your side now. Called me the next day, quite angry because, Amy, I tried sleeping on my side and it hurt. I'm like, well, then don't do that is the answer. So all of these things, you need to stay within your own pain level and threshold for all of these things. Your ears might hurt for longer than 3 weeks. So Dr. Wright, what's the last one there on week 7?
Amy, you got to love your results.
Yes, live your life. You just did an awesome surgery.
And you look awesome.
Yeah, love it.
That's what we love about the surgery. People look kick-ass.
Yeah, you look good.
Let's get excited. Let's celebrate life. Let's celebrate the fact that you've done something positive for yourself and you're on an awesome path and you're not letting aging get the best of you and you're moving forward. And
your life goes on.
Empowered and you're feeling good. I love it. Mm-hmm. Let's go.
Yeah, love your results. I think that
I feel like we should start doing an exercise class right now.
An exercise class? You want to get the leg warmers out?
Yes.
Yeah.
God, you're like examples are all like 80s and 90s. The only thing you haven't brought up is Goonies and Temple of Doom yet.
Well, there you go. There we got all that out of the way at once. So, Dr. Warren, what's your wrap up on Facelift? So everything you know about Facelift, we've talked about start to finish, all the way till week 7, loving your results.
Yeah. So facelifts are transformative procedures, but they're nuanced and they're subtle and they're natural. So a lot of transformations we have are amazingly different from beginning to end. A body lift, a tummy tuck, a mommy makeover. But these things are just so nuanced and so subtle. I love them. I love it for that reason. But you have to go to someone who's proficient in these surgeries. You have to go to an office, ENT surgeon board certified, plastic surgeon board certified, maybe oral maxillofacial surgeon, people that do this on a regular basis. You have to go to someone like that because it is very important. There is no going back for problematic facelifts. You cannot reverse time, right? If you have a problem with your breast, it's covered. Your face is not in most cases. So I think
He means it's covered up, not like it's covered. We got you covered.
Oh, it's covered up.
Yeah,
yes.
It is
Thank you.
Concealed.
It's concealed.
Potentially. We have patients who have breast surgery that goes wrong that is very hard to conceal.
Yeah.
In normal clothes.
Yeah. So I think that, that's true.
Not our patients.
Yeah, our patients. No, you're right. So fixing, you're absolutely right on
Yeah.
that. So it's really important you do your due diligence. It's really important you find someone who's proficient, but most importantly, and we established this in both episodes, that has the same aesthetic vision as you, that the words that come out of their mouth kind of feel good to you. The office staff looks the way you want them to look.
This is magic sounds good to most patients, so maybe not that.
Okay, yeah, that's true.
It shouldn't just sound good to you. It should actually make sense and be real.
And make sense from a logical standpoint and what your outcomes you want. And then also you have to really scope it in. Once you go into the operating room, I can tell you all that stuff, but you're asleep, right? So then you have to trust that the person's going to do the right thing. And I know that's hard. Afterwards, you have to be prepared. Don't be dumb. You have to plan beforehand, make sure your loved ones are there for the first couple of days. But after that, you're pretty self-sufficient. And then you just don't work out. Don't overdo it for the first 4 weeks, maybe 6 weeks after surgery. And you're going to be super happy with your results. Our patients are universally happy with their facelift results. They don't look weird. They don't regret it. We don't have patients regretting their decisions. And And the one last thing I'll tell you, and this has nothing to do with the question she asked, but we get a lot of people to come in, and I don't know why I've noticed this more lately. They say that I should just wait till I'm 65.
We talk a lot about that in our Aging Like a Hollywood Superstar episode.
Yeah. Or I should wait till I'm 57. I should wait till I'm 60. And it's always an arbitrary number. And that goalpost keeps getting moved down and down because all you're going to do is find something else. My kid's going to college. Financial reasons, which is reasonable. I can't do this. I have this trip to go on, that to do. Like, if this bothers you, check that box, get it done with someone good, and move on.
That's the love of your results.
Right.
Like, why spend the next 10 years still disliking this? I said that to a patient before surgery who was like, am I too young for this? She was in her late 40s. I'm like, are you happy with how you look right now? No. I'm like, do you think you'll be more happy in a couple of years if you do nothing? No. Like, there you go.
Take care of it, right?
Yes.
Sometimes you can't because of medical reasons, financial reasons, life reasons. But if you can get over those hurdles and it bothers you and it's not going to stop bothering you, take care of it. Mm-hmm. Find a good surgeon who will make you look natural and nice. You're not going to regret it.
You're going to love your results. You're going to live your life.
I feel like that was a public service announcement for Facelifts. I have a lot of passion about the surgery. It kind of mixes everything that I love: the small, the big, the artistic, creative parts, right? The proficiency, the repetition, the efficiency, all the kind of little things that I love. Yeah. It's like a perfect surgery.
Well, we get to know these patients better than some because it is a more involved recovery process.
It's more intimate for the patients.
Like it's a little more. We get to know these people.
You get to see them more.
Yeah, we get to see them more. We see them way more times than like just a breast dog or something that's pretty quick recovery. So
yeah.
Yes, everything you know about facelifts. If we've left something out, please let us know, because there could be a part 3 and a part 4, and like we keep going. But definitely listen to some of our previous episodes where we talk about recovery. Also, can fat predict your age, and how to age like a Hollywood superstar. Address a lot of the kind of common misconceptions and facelift myths that people have. We have a whole episode about facelift myths. Myths. Can't with the words. Myths.
What word is that?
Myths.
Mist? Is it a facelift mist?
Myths.
Okay, myth.
They're the myths.
Yeah.
So thank you everyone for watching. We really do appreciate it. If you enjoyed this podcast, please be sure to like us, comment, rate us, review us, subscribe, hit the bell for notifications, do all the things, all the social media things. You can also find all of our social media here. We're at Jason Martin, MD, and at Beauty and the Surgeon Podcast, everywhere you're following us. If you'd like to leave me a voicemail, you can do that at 303-630-9038. Really do appreciate hearing feedback from you guys. It helps us be better.
We love your comments, by the way. Yeah. I read them all. Thank you.
Comments are awesome. Thank you, everyone. We'll see you next time.
Bye-bye.